I'm Dr. Betsy Greenleaf, and we're here with another episode of Body, Mind, Spirit. I'm very excited. Today, we're going to be talking to Dr. Sabrina Salt, and we're going to be talking about a subject that we see a lot of commercials on lately, but not, or actually for a while, but nobody really talks about it. We're going to be talking about ED, or erectile dysfunction. So I was just looking at the statistics that they're expected to be within the next couple years up to 322 million cases of erectile dysfunction. And that this is such a prevalent problem for men. And we see the Viagra commercials on TV all the time, but we're just really not talking about it the way we should be. So, Dr. Sabrina, tell us like what you do and how did you get into this?
Yes, so I'm a naturopathic medical doctor and I currently practice in Scottsdale, Arizona. And I've been actually just doing regenerative medicine for a number of years. And within the confines of regenerative medicine, we basically use things to stimulate the healing process in the body. And one of the healing processes that I started stimulating was erectile dysfunction. And it kind of just snowballed into this population that I ended up loving to work with because the transformations that I would see in these men when we were able to get them to the point where they were getting their erections back again, they were overall happier, they were performing better at work, their marriages were better. I was like, you know what? We need to be addressing this. This is actually like the hidden epidemic. And I've kind of snowballed my practice into really emphasizing how can I help these men to such a degree so that we can effectively change the landscape of this disease process and ideally get rid of it.
I think too often many people just, especially when it comes to sexual dysfunction, I mean, I see it from the women's standpoint, you're seeing the men, that everyone just kind of blows it off and thinks like, oh, this is just a normal part of aging. And that they just don't think that there's things that can be done for this. So,
Yeah, and it's so funny that you say that because ultimately human beings are just fancy animals and the whole goal of existence is reproduction, procreation. So to just kind of like shove sexual function under the rug and just say, oh, I'm just getting older, you're literally missing out on the essence of existence. And the truth is that erectile dysfunction or any sort of sexual dysfunction, whether male, female, it's actually a symptom of something else going on underneath, meaning it is not a problem in and of itself, but it means that there's other things that need to be corrected too. And that's why it's so important that we actually start talking about how do we actually heal this versus just giving them the Viagra or the Cialis or any other, pharmaceutical tricks that they have that only get rid of the symptoms.
that is so important to bring up. So what kind of things can erectile dysfunction be, telling us? Because it's really saying, hey, there's something else going on with the body. Pay attention to me. What kind of problems should we be concerned about?
Yeah. So in the absence of, say, like a very traumatic injury to the area, there's kind of three things that we need for a healthy erection, and that's adequate blood flow, it's adequate nerve conduction, and it's adequate hormone levels. Normally with men, I like to start with hormone levels. We need to see what your testosterone is sitting at, see even what your estrogen is sitting at, your even the progesterone, DHT, BHEA, those are all things that we look at to get the symphony of what your hormone picture is. Because men need a testosterone level of at least 200 or 300 to be able to just get the erection in the first place. If you're sitting below that, which a lot of men actually are, you're not going to get that signaling that's necessary for that erection to go. Once we've kind of got that figured out, now we need to see, okay, is there something nerve conduction going on, right? Because we need our nervous system functioning to be able to get the erection, also to ejaculate. The kind of thing that I like to use to reference this is actually point and shoot. Point being your parasympathetic nervous system, meaning you have to be able to get into that rest and digestive state adequately enough for that erection to occur. That's why it's so common to have morning wood, because you're in that rested state. So it just pops up first thing in the morning. And if you aren't getting that, that's actually one of the first things that you should be going to your doctor with. If that morning wood goes away, we need to start looking at the problem now. Next thing, we need to be able to get into sympathetic in order to shoot, in order to have that ejaculation. So you actually have to be able to amount that arousal state to such a degree that you're activating and switching over to that sympathetic nervous system. Finally, the last thing is that we need adequate blood flow. Now, the adequate blood flow conversation we could go on for hours on this because there's actually so many things that can impact this, both positively and negatively. The traditional medications that are on the market, your Viagra, your Cialis, those are actually working on the blood flow mechanism by stimulating nitric oxide production, nitric oxide release in that vasculature. But we also have disease processes that can negatively impact your blood flow. Talking mainly things like diabetes, heart disease, all of those things are negatively impacting those blood vessels, causing possible plaque formation and just general damage. And there's so many blood vessels in that penis, and there's so many tiny blood vessels in that penis too, that any sort of damage to them, well, now all of a sudden we're getting these erections that are not as hard, not as strong, not lasting for the entire duration.
Yeah, that is so important. I remember I had this conversation with my cardiologist recently. He was saying that they see so many issues with their patients with high blood pressure and heart disease, and that the erectile dysfunction is one of the first signs of a problem, but people don't know that. So they're not going to their doctors to have things checked out. So
Yep, so important. Again, if erectile dysfunction is an issue that's going on, talk about it sooner than later because it is correctable. It really is.
and from a hormonal standpoint, what is causing that low testosterone?
Oh my goodness, what isn't causing that low testosterone? We could go on for hours on this too. I'm actually just writing up a thing right now. I have seen so many men because, well, people are working, right? And when they go to work, they bring their lunches usually, and they bring their lunches in these plastic containers and they're microwaving them in these plastic containers. The leaching of the endocrine disruptors from that plastic into the food, plus the microwave radiation destroying any nutritional value in that food, I see that tank testosterone more often than you would believe. Not only that, there's all sorts of other endocrine disruptors that men are exposed to on a daily basis. Axe body spray, regular old deodorant. I mean, you're applying those first thing in the morning, you're totally disrupting all of your hormones. Also, lack of exercise. We don't see men exercising as much as they should be for optimal health. And doing things like squats and deadlifts, those are going to pack the biggest punch as far as actually increasing your testosterone levels naturally. Other things that are going to be decreasing them is going to be people gaining weight. So in the actual fat tissue, there's a process that happens called aromatization. And that's actually the process of turning testosterone into estrogen. So it's kind of the cyclic thing that happens. You gain some weight, you convert to estrogen. You convert to estrogen, which makes you gain more weight. And it's on and on and on until you end up with a gentleman who has that typical quote unquote dad bod, lack of libido, inability to exercise, brain fog, can't perform at work, and he's wondering what the heck is going on.
That is so incredibly important. I wanted to ask you more about endocrine disruptors for people that might not know. What does that actually mean?
So an endocrine disruptor is any chemical, whether it's a synthetic one or a natural one, that's going to inhibit or turn off your body's ability to make your own hormones.
Is there a way to find out what endocrine disruptors are, or what should they be avoiding?
The most common things that people should be avoiding, like I mentioned, fragrances, receipts. Those are another big one too, that like thin, shiny paper. Getting that on your hands combined with hand sanitizer is one of the biggest endocrine disruptors that's out there. It's fascinating. I remember reading that study and thinking, that's what they're forcing everybody to do in every store right now. Sanitize your hands and then take your receipt as you head out the door. And it's completely messing things up. Let's see, another endocrine disruptor, smoking is going to be an endocrine disruptor too. But those a whole bunch of chemical soup in there, all destroying the hormone levels that you have.
I saw that about receipts and I wasn't quite sure, like, is it the ink? Is it the paper? But like every time I take a receipt now, I'm like, I don't know what to do with it, Or like, when I get my gas at the, I'm in New Jersey, so I don't have to pump my own gas. So when they're handing my receipt, I'm like, I don't need it. Thank you. So pass on those receipts. So, I wanted to also bring up Viagra because a lot of people equate like erectile dysfunction with like, oh, well, I'll just take Viagra. And we were talking before this that, prior to Viagra coming on the market, erectile dysfunction was even less talked about than it is today. And then we looked at 1998.
Yes.
When presidential candidate Bob Dole became a spokesperson for Viagra. So here we have one of a major politician who comes out and was like, hey, I've experienced this, let's talk about ED. So, from your standpoint, I'm going to go back and be like, from your standpoint, how do you, from what you see, are men feeling comfortable talking about this?
Once we normalize it, yes. It can be one of those things where most men have a really amazing connection to their penis and how it performs. And a lot of times they equate their own self-worth to how it's performing. So it can be a big point of contention in both their personal lives and also with their partners if things just aren't working the way they should, because then they feel like they might be less of a man. And that's not the case, because most of the time you just don't know what you don't know that caused that. And it's not a moral failing ED. It's just something that happened. And just like getting a cold, right? Like nobody's going to blame you for getting a cold, but like do the things you should do to get better. Have some chicken soup, rest up a little bit. And we do have tools that can actually help fix that.
And it sounds like it's really just a lot more than just coming in and getting your little blue pill. So how does Viagra and those medications work?
So Viagra, Cialis, all those ones, they're basically going to help increase that nitric oxide boost into the penis. It's going to help those blood vessels get engorged. And that's why it's important to actually not take any supplements that will boost your nitric oxide in combination with. The most recent research actually that's come out has actually shown that Viagra is now going to be not approved for, but possibly marketed for Alzheimer's disease. And I do believe that it has something to do with how it enhances that blood flow and that nitric oxide. They've seen benefits who've had different dementia states and cognitive dysfunction states, and they do improve with Viagra uses, which is pretty neat.
It's actually really interesting because it really started out originally as a medication. They were looking at it for like heart disease and pulmonary hypertension. And it just was in the studies. One of the side effects was men were reporting improved erection. So then they were like, let's relook at this medication and find another use, which it's still being used for pulmonary hypertension. But an interesting side note is we use it in women in the urogyne field too, because once again, it just increases blood flow to the genitals. But one of the misconceptions I see with my female patients is they're like, well, give me the pill that's going to make me horny. And I'm always telling them like Viagra doesn't put you in the mood, but once your brain is in the proper state, because your brain is your most important sex organ, then you start that process that will increase the blood flow to the genitals. And if women, we end up experiencing with Viagra or those sorts of medications, increased lubrication, increased sensitivity, muscle relaxation. So unfortunately, the companies that came out with this did not study it. They were studying it in women, but they were studying it for libido. And I'm like, you weren't studying the right things, but it's great that men have that option. So, so what other things do you do for them when they're coming with these complaints?
Yes. So in addition to obviously doing the hormone replacement therapy, a lot of the times we'll talk about how they can use various nutritional supplements to actually heal and correct some imbalances they might be experiencing, whether they're not eating a right diet or they've had some damage that's occurred. But we can also do regenerative injection therapy. And regenerative injection therapy is kind of this broad title for utilizing any product such as PRP, amniotic allograft, exosomes, stem cells that we can actually inject into the penis to stimulate new blood vessel growth and actually heal the conditions that have happened in there. It also even works very well with patients who suffer with Peyronie's.
This is great. I'm going to want to ask you some more about this when we come back from the commercial break.
Great.
80% of women will develop a pelvic health condition at some point in their lives. There is relief. There is hope. The Pelvic Floor Store, your resource for personal health.
So we're back with Dr. Sabrina Salt, and we are talking about how to be harder, happier, and healthier. So for those men and for the men in your lives. So I wanted to ask you before we get into the injections, because I can't wait to ask you more about that. It's really come up in the last couple years, this process of using shockwave therapy on men. So shockwave kind of sounds a little scary, the name of it. What is shockwave therapy and how does that work for erectile dysfunction?
Yeah, so shockwave therapy has been around for, gosh, at least I would say 10 years or so. We started bringing it into kind of the urological world when we realized, hey, this thing works really, really amazing at creating new blood flow, generating neovascular genesis, and just kind of enhancing even stem cell proliferation in that area. Why wouldn't we apply it to the penis? And it's has worked really well. It does require quite a few sessions. We usually start with at least 6 sessions, so twice a week for 3 weeks. Some men do need more, some usually need about 12 or so. But it really, really helps by basically it applies a shock wave, which is a really targeted type of wave under a certain barometric pressure. And it's going to stimulate those blood vessels to heal and also renew and also grow new ones so that we're going to get that increased blood flow to the area.
So that's important to note is that I've had people try to come to my office and they're like, oh, I just want to get one treatment, and I'm going to be good.
No, this is something that you got to kind of be strapped in and ready to know that you're going to be coming multiple times to actually get that true healing.
Yeah, because it's kind of like you can't just work out once and be expected to be in perfect shape. It just doesn't work like that.
Precisely. And the other thing too is that every part of our body is kind of in a different stage of healing and regeneration. Even if we just take something as simple as the hair, not every single hair on our head is in a growth phase. Not every cell in your body is in that phase either. So it's important to continue to do those treatments so you're getting those cells when they're in the different phases. So you're continually stimulating new ones that are actually ready to heal.
Now, then we move on to what I think is fascinating that you do tons of is this regenerative therapy with injections. Yeah, that also sounds scary. So what man is going to let you come at them with a needle? And so
a lot,
this.
actually. Yes, a lot. Actually, you would be surprised. And it does sound a little scary that, oh my gosh, we're going to be injecting the penis with various things. Because of course it's a very, very sensitive area and men are very guarded about what happens there, but it worked really, really, really well. And I will tell you the process itself we try to make it as comfortable as possible. Now, I've personally never had it done because I don't have those parts, but I've never had a gentleman tap out or tell me that it was too much or that he couldn't handle it. We do actually start by having the gentleman apply a very, very generous amount of a very strong numbing solution, not the type of numbing solution that you can get on Amazon. This stuff has to come from a compounding pharmacy and it's made strong for these delicate types of injections. And we let that sit for about 15 minutes. And to even enhance that process, we have the gentleman put a glove over top so that the heat helps drive that in a little bit deeper. And it works exceptionally well. When we are doing the injections, we're actually usually doing about a total of 5. Sometimes we do more if the gentleman has peyronie's. But the way that the injection is done, let me see, I'll use my finger. Okay, so pretend this finger is a penis. We actually do injections kind of about a third of the way from the base into the 2 tubes that are within the penis. Every man knows if he's, played with his member a lot, there's actually 2 tubes in there, and those are called the corpus cavernosum. So we got to make sure we are injecting both tubes because that's where that spongy vascular tissue actually lives. So again, 2 here, about a third of the way from the base, about 2 other ones, about a third of the way from the top. And then we actually do a really nice injection into the vermilion border of the head itself. So that's that tissue that's kind of right at the edge of the head. And this is a really lovely injection because what it does is it's going to enhance that size a little bit, but it's also going to enhance sensitivity really well too, because again, that is the most sensitive spot. And contrary to what you might think, that's actually the easiest injection for most men to get. They can't even feel that one. It's because the numbing solution gets taken up so well in that tissue particularly.
How long does these procedures take?
You're in the office for about a total of an hour, depending on which biologic we use. If we use something like an amniotic allograft, well, that's an off-the-shelf product that we don't have to really do much preparation for. But what we also do with that is we do deliver a nutritional IV during this so that we're actually kind of saturating all the rest of your cells with a whole bunch of nutrients that's going to enhance the healing process so you get better results. So that takes up some of the time as well. And then the actual injection itself is actually pretty fast. We're talking under 10 minutes, depending how many breaks he needs in between the injection sites. If we're doing something like PRP, that's a little bit longer because that's PRP is something that we get from the patient's own blood. It stands for platelet-rich plasma. That processing takes a little bit longer because we have to, of course, put the blood in a centrifuge, process it in order to be able to get that platelet-rich plasma from it. But during that time, the gentleman is getting numbed up and he's also hanging out in a nice massage chair, just relaxing before the actual procedure itself.
And what is the recovery like?
Yeah, so I would say most men experience a little bit of bruising at some of the injection sites. Again, it's a very highly vascularized area. It's almost impossible to not bruise. And sometimes it can be a little bit achy afterwards. And that's actually a good thing. A controlled level of inflammation and a little bit of an ache for about 3 to possibly 7 days afterwards, completely normal and part of the healing cycle, which we should touch on that actually is what the healing cycle actually is. So first 3 to 7 days, you have that controlled inflammation where we're telling the body, hey, bring more blood flow to the area and start doing something with this because it needs to be fixed. The second stage is actually the proliferation phase. And this is the phase that lasts about 3 weeks. And during this phase, we're actually telling the tissue, hey, we're going to start laying new stuff down here. We're going to proliferate those new cells that are going to eventually be that new tissue. Then we get into the last phase, which is the remodeling phase, and that's where that new tissue actually gets laid down. This phase starts at about the 3-week mark and can actually continue for up to 6 months or even a year afterwards, depending on the biologic that we use. So we know that we can get continued regeneration for quite a long time. And if we were going to reevaluate for a second treatment and see how he was doing, we'd usually evaluate between 3 and 6 months afterwards.
That's a really good point. I was going to say, how many of these treatments, because we were saying the shock wave, they need anywhere from 6 to 12, but how many of these injections?
We always only ever start with one with the injections. And if there is somebody that is telling you that you need more, get a second opinion. And that's only because we need to see how you're going to respond in the first place. If you don't respond at all to that injection therapy, one, I probably missed something, and there's something else that we need to look at as far as what else could be going on here. And two, if it didn't work the first time, why would I try it again, right? But if you get anywhere in between that, from maybe a 20% improvement to an 80% improvement, chances are you would qualify for a second treatment, and we would do that as necessary.
How soon after the injections can they engage in sexual activity?
Awesome question. And I say right away. So there's really no limitations on when we want them to actually engage. And in fact, the more frequently they're pulling blood flow to the area, the better. And I usually recommend the gentleman doesn't have a sexual partner that he gets a penis pump. And that's going to be a really great way to kind of just pull blood flow to that area on a daily basis afterwards.
I've heard that about with any of these treatments that using a penis pump afterwards can help with development of those blood vessels and the health of the penis. How does the penis pump actually work?
So it's just a device that they put on the penis, and it uses a suction to basically pull the blood flow in and kind of cause some engorgement there. And they really don't need to do it very often. A few minutes each day is going to be adequate to just get that blood flow to the area. Again, if they don't have a partner that they're going to engage with.
This is actually really great. And then, I'm sure a lot of people ask you after they've had these treatments, is this going to be permanent?
Oh, yes. Great question. So the cool thing about regenerative injection therapy and how it varies from, say, the pharmaceuticals is that we're actually causing true healing to occur, meaning whatever healing you get is yours to keep, the same way that, say, if you were to get a cut on your arm and it heals up, well, that's not just going to spontaneously open up or worsen on you because the healing that you got is yours to keep. So that's why it's also important for these gentlemen, once they actually undergo these therapies, to really kind of make those enhanced lifestyle changes so that they are maintaining these positive changes and not necessarily reverting back to their old habits that would cause them to land there again.
Now, a lot of these therapies are not covered by insurance companies. What is your take on that?
It's kind of twofold. One, it would be lovely if they would acknowledge the efficacy of some of these therapies, but at the same time, we also don't necessarily want an insurance company dictating whether or not a man can be approved for this. We see this even with testosterone therapy. A lot of the times we have to go outside of the insurance model, even just to give a man testosterone, because their levels for man have qualifying for that are just so outrageous. And there's so many other men that can benefit from it.
I used to work in a urology office, and we were insurance based, and this was like the bane of our existence is men with low testosterone. They'd come in, they would get lab tests, they would get prescribed testosterone, the insurance would cover it. And then when it came time to renew their medicine, the insurance would be like, well, we're not going to refill their medicine until we get a testosterone level. And we're like, well, their testosterone is better because they're getting treated. So then you would get the testosterone level. It would look better. Insurance would be like, oh, we're not going to pay for it because their levels are better. I'm like, you don't ever see that with like thyroid. You don't see the
or
insurance company. Yeah. Go like, all right. Yeah. Your diabetes is better. So we're going to stop covering your insulin or your thyroid medicine. But it would happen all the time with testosterone. And in the insurance model, they'd have to play this game where they'd have to stop their therapy to get it covered. So this is why I love to bring up to patients, we got to get out of that mindset that health is an expense and that it's a cost. I mean, you're investing in your health. You only have one life to live. Don't leave it up to somebody else that's dictating what you can and cannot do. So
precisely.
Yeah, get off my soapbox for a minute.
I agree with you 100%. It's so important that men look at this as an investment in their health, because ultimately they're going to show up as better, bosses or employers or husbands or partners or parents or siblings. Like, you just become better, and you really can't put a price on you being at the top of your game.
When is there like an age range that is important to start? Like, can you do preventative?
The right age to start is right this second, because you're never going to be younger than you are right now, truthfully. Men, whether they're in their early 20s or even up to their 80s, here's the thing, you can still regenerate. Like, as long as you're living, you have active stem cells and you have the things within you needed to heal. I don't believe that age is a factor in that. And I believe that we have tools to overcome that. So best age to start is right now.
And I think that's important, because I think it's easier to kind of regain something if you're doing it preventatively than wait for a disease state to show up. So
I agree 100%. Yeah. If you can do all the things that are, the healthy lifestyle, the adequate sleep, the good diet, you're going to live longer. You're going to be harder, happier, and healthier.
Now, you're located in Arizona, which, I definitely recommend patients to go find Dr. Sabrina Salt. But also, if patients are not able to get to where you are, what should they be looking for in a practitioner?
Generally, a practitioner who has more experience with either functional or naturopathic medicine, somebody who's more focused on getting to the root cause of the issue versus just giving you a prescription. That's my bare minimum.
That is really good advice. And then I would ask you, where can people find you and get more information about what you're doing?
Yeah, so I'm on Instagram as at Dr. Salt, so DrSolt. And my main website is www.stemcelltherapypro.com. People can find me there as well. There's also links on there to schedule discovery calls, and there's lots of information on there that they can read about.
This is wonderful. And I think, really we need to start working on this, younger, and make sure you're healthier. And so once again, Dr. Sabrina, I'd really like to thank you for being here today and talking about this topic, because it really does affect so many people's lives. And, just like I talk about with women's issues, it's not just a male and female issue. This affects everybody. It affects work performance. It affects relationships. It affects confidence. So this really affects so much of a person's life, and that we need to be talking about this. So I thank you once again for being with us.
Thank you so much for having me. This was fun. It was a pleasure.
And I just want to remind everybody, if you really enjoyed today's programming, make sure you check us out at WYTV7.org. Don't forget to donate, because even the smallest amount of a donation not only helps to bring great programming like today's, but also take a look at all the activities that we're involved with when it comes to charitable organization. Our mission is empowerment and education. And once again, lastly, our theme for this season is try. So Dr. Sabrina, what do you want people to do to try more of?
Oh gosh, try more of putting yourself first.
That is I love that. That is wonderful. So once again, thank you so much, and tune in again next week for Body, Mind, Spirit.